Hi guys. Can you see me? And can you guys hear me? Hello, hi, good afternoon. It has been a while, 4 months since my last video, right? But I am so sorry about that. So before I go into any explanation or talking about this next couple of clips you're going to see in this video, I want to say welcome to my channel if you're new here, and welcome back if you're a returning subscriber. I am so sorry for the really long hiatus. The whole of January this year, I wrote my fourth MBBS examinations. The last video I uploaded was like 4 months ago, I think October time or something. So I was studying the whole of October, November, December was 3 months of intense studying. I didn't even spend my Christmas at home. I spent my Christmas in school. So that is why I have not uploaded since. That is a reason. I've just not had a perfect time to record. Good news is that I passed my first MBBS exam. So you guys are now looking at a final year medical student. Can you clap for me? Okay, I think I need to clip on this mic so I can clap for myself. Thank you. Clap for me. I am clapping for myself. So am I forgiven? Okay guys, the last video that I posted here were like videos I shot September of 2024. The next videos or clips that are going to see in this video are clips that are shot from October of last year to like January of this year during my exam. So it's just going to be a lot, but don't worry, I'm going to take us all through everything. Okay, so you guys, you kind of understand where I've been and what has been happening in my life. But don't worry, I'm still coasting, nothing serious, just a final year medical student at the University of Nigeria. Nothing new. Okay, let's talk about what happened in October. The big thing that happened in October last year was my birthday. I didn't do anything big, just I had my birthday. Then we moved, my class members, we moved from our hostel, that hostel that you guys have been seeing in my video for the past like 2 years or a year plus. I am no longer in that hostel. We moved to another campus or another hostel, and this hostel is in the hospital, so I no longer travel to the hospital for school, like the same location. So that was the big thing that happened. I moved, packing, buying things that I needed for the new hostel and everything. And when we moved into that hostel, there was no lights. There were so many things going on, and unpacking took me like a week. Just see my load. No, that pink box is not for me, but everything here is for me. I stayed in this room for like 2 years. Yes, 2 years since 2022. And now I'm leaving. Oh well. Oh my goodness. See everybody's tongue. Guys, this is my new hostel. Let me show you guys my room. Guys, just see. Guys, Nines is my roommate. So she has dropped her things and she ran away. Because this place is so messy. But there's some people that are supposed to come and clean it today. So they're cleaning another room, so after that they'll come and clean up this one. So yeah. Hi guys, good morning. I've not finished unpacking. I won't finish unpacking today. I won't finish unpacking tomorrow. As usual, let me show you guys the state of my room. It's a mess. Okay, warning, it's a mess. Guys, just see. Okay, this is the middle part is supposed to be my space. This is my roommate. You guys know it, right? So these are her stuff. She has not unpacked yet. And this one is for me. Guys, just we are supposed to put our beds together, but normally other rooms they have it like a U shape, like a bed here, and then the one in the middle would be placed horizontally like this, close to the wall, like at the edge there. We wanted to put our beds together, but I don't think it's going to work. I think I'm still going to turn my own bed because I got the middle space. So I think I'm still going to turn my bed to the wall, like place it horizontally across. Guys, good morning. Today is Wednesday. Yesterday, after I showed you guys my room, I sprayed insecticide and I went to Joy's room. And when we came back, guess what we saw in my room? A scorpion. Yes, a scorpion. I'll post a photo of the scorpion because I was so shocked and I was so scared. I didn't make a video to show you guys, but we saw a scorpion. So I sprayed another insecticide and I slept in Joy's room yesterday night. So this is Wednesday morning. The time's around maybe to 11 or so. I've rearranged my bed. I'm going to show you guys, and that is how I think this bed is going to be. Guys, this is how the whole thing is going to be. My bed will be like this, Net's bed, then Ife's bed will be here. Okay guys, hi. It's time for me to get my life in this nigga hostel together, arrange this whole place, and Net is back, so we're going to do that together and know if this room will have a good look, basically. So Yes, time to get to work. I'm not even going to change out of this white because it's already dirty. So time to get to work, guys.
What happened? You don't see what they posted that they saw scorpion in one room. No, I enjoy it. I now saw 207. I want to ask you. If I were around yesterday, I would have asked you. When I came, I was having PTSD. Girl. I said that doesn't find me. This girl. Oh my god, that's scorpion was. I not even sleeping. I went to Joy's room, guy. How did you even notice it? No, it was Joy that saw it. Joy was like, is this the non-scorpion? Because I saw one nickel. Joy was like, is this the non-scorpion? Like, I was now like, nah, that's all. I could not even see it. Like, I was so scared. I was screaming. Like, I was so a girl.
I had to get so many things. That room is so tiny. You know what? This new hostel is not even it, but it's our final. I'm counting down my days in this school, so let me just go and go. You understand? So that, and then what else? My friend Chungan, do you guys know Wendy, right? She was inducted into the physiotherapy profession.
Happy induction! Thank you. Today. I'm so proud of you. Thank you.
So I went to see her, guys. I was so happy for her. Like I and Chinwendo and my other friend Chinenye, we got into the school together, and they are done with school, and it's just me. I'm the only one remaining, and by the special grace of God, this year I'll be so done, so effing done and out of here. Okay. So I was so happy for her. Like I was so proud of her. You know, passed all her exams and left the school without any wahala. So I was really happy for her, and it was a very happy day. And after trying this induction, what else? I don't think anything monument. Okay, around that November time, that same November, I sent my senior block of ONG of Sangana posting, and there's something that we do called baby catching, where we go to like different hospitals and observe the birthing process, like a woman giving birth, basically giving birth. Let me stop this. My accent changed, guys. Like I'm sounding a little bit more Americana, British. You understand what I'm saying, right? So we went to. So we were you as you know what? I'm just going to go back to being Nigerian, okay? We were mandated to go to some designated hospitals and then watch the birthing process and aid the nurse, the midwife, or the doctor there. It was a very interesting process. It was a lot. I made a couple of clips, but I can't just enter there with my phone and like video women giving birth and everything. But one of the things that I learned from it is, when women ask for like push gifts after giving birth. Before I thought it was ridiculous. Like I was like, girl, but now, girl, if they give you that push gift, don't say no. Like if you can ask for it, don't say no, guys. It's a lot. Like
This is the labor ward. Okay, time to go in. This is the main labor ward, guys.
before you hear, even as medical students, you just see things, observing it, watching that baby come out from the mother is, man, after your wife gives birth, the Lord should increase for her, because what she just did, kill. So that was it. We watched it, and it was very I don't know. After watching that thing, if you're having any baby fever or any ovaries shaking, you know how you see babies and you're like, my ovaries, you stop, because like if you remember what you saw in that baby catching posting, your brain will reset. Okay. So after that, that was November, entering December. After that, we stopped our postings, and then we now started have intense revisions and studying, guys. Jesus Christ, my classmates, we studied. Like this is not even the exam that you say that some people relaxed, some people just were not studying. Guys, we read. Got MBS exam in my school. Some people call it the rate limiting step. So we took that exam so serious, because in my school you can repeat, like, not graduate with your set if you failed the receipt of this exam. Like, it was a lot. Oh my goodness, guys. Guys, I read. My classmates were just on fire. The whole of December was studying, night class, doing a couple of group study. I had my roommate Minette. I wanted to do a little group study, like just the both of us, and it flopped. Okay, I don't know. We were both unserious. If she's watching this, she'll say that I was the unserious one, but I am saying that she was the unserious one. Okay, hi Minette. Hi. January 3rd was when our exam started. You can imagine our mates were enjoying, rolling into the new year, thanking God, and we are starting a big ass professional exam.
Hi guys, today is the 31st of January and the time is 4:30 a.m. and I am studying because my school fixed my exam on this January that we're about to enter. I'm starting my mock on Friday, 3rd of January. So I'm the only one here because others have left. I didn't know when the last person left, so wish me luck. God, I'm so tired.
So, anyways, January 3rd was the day our mock started. It started with O&G mock. So we wrote it. It was okay. It was not a hard exam. And the Monday after that, we wrote our pediatrics mock. That one was okay as well. For our mock, for both pediatrics and O&G, we write MCQs and then a picture test where pictures are projected. We choose the correct answer about that picture, like the single best option about that picture. So we wrote that. Then I think a week after that, after the pediatrics mock was on a Monday, then the next Monday after that, we started our main MCQs, theory, and another picture test. The same different days, or MCQ theory one day, the next day picture test, MCQ theory of pediatrics one day, the next day picture test of pediatrics, OSPE, objective structured picture examination. I think that's what it's called. Our main for both of them was crazy. It was very crazy. I don't even want to talk about it. It's like, it's trauma. Okay, a little PTSD, if you understand what I'm saying. So after that, the next week after that was now our clinical examinations. Like, OSCE is also part of the clinical examinations, but this one, the OSCE one, for O&G, it's called Objective Structured Clinical Examinations, OSCE. Now, this month OSCE is like, we have like for obstetrics, we had like I think 7 stations or so. It's one rest station, or 6 stations. It's one rest station. Yeah, 6 stations. Each station there is a consultant, a professor, a doctor, whatever there. Where you come, you do something clinical, and they score you in sheets. We had like the history taking. There was one of a pregnancy when we had to palpate the pregnancy. There was one where we had to answer questions about, what was that question again that we answered? It was about, Jesus Christ, I just showed this exam like 2 months ago. Guys, what the hell? It was about prolonged labor, I believe. Induction of labor. Yes. The question was how to induce labor. The other one was pathograph. The other one was grandma. It's a lot. Let me just not bore you guys with details. That the next day was gynae OSCE, and we went there, did our thing. We passed speculum.
On inspection, the vulva is healthy looking. There is no ulceration. There is female pattern of head distribution, and there is no female genital mutilation. Okay. Putting on my gloves and maintaining aseptic.
After washing my hand and putting my gloves on.
Washing my hands and putting on my gloves. I'll check the speculum for functionality. Making sure that the speculum is functional. I'm going to pat the labia. And ma, please can you turn your face to the side and cough? Okay, good. Can you please bear down like you want to give birth? Thank you very much.
Comment on it, please.
There are no signs of stress incontinence, and there is no sign of pelvic organ prolapse. So I've been my patients. Thank you.
Okay, ma, I'm going to put this speculum into your vagina now. Holding the speculum like this. Where she's sitting? Where she's sitting? Okay, ma. The cervix is healthy looking. There's no ulceration. There's no bleeding. The vaginal walls are also healthy looking, and there's no ulceration or any vaginal discharge. Retracting the speculum and holding my fingers between the blades to avoid the entrapment of the vaginal. Pass the speculum into the cervix. It's called history taking. Answer questions about pap smear, cervical cancer screening. Okay, let me just use this opportunity to educate you guys a little bit. If you're a lady watching this and you're 21 years and above, please make sure to start going for your cervical cancer screening. It's very, very extremely important. If you are not sexually active yet, if you are a virgin, and I don't think you don't need to do that. Even if you go, they'll ask you if you're virgin, they won't do it for you. So because it's invasive, like through your vagina and everything. So, but if you are sexually active and you're 21 years and above, please go to any medical center around you or any hospital around you and just ask them how you can get it done, or any OBGYN specialists around you. Actually, they should have, some of them have the equipment, so they can do it for you. I don't think it's the most expensive procedure. You know, it's affordable, I believe, because from this way they can see any precancerous lesions and stop it from progressing to cervical cancer. As we know that cervical cancer is very, very common, especially in third world, like low and middle income country, which our dearest Nigeria is a big one. Is a big part of. Nigeria is a seriously low income country. Okay, so please go get yourself checked out. It should be done every 3 years. Every 3 years. And it depends. It's a long story, but just go and get yourself checked. It's very, very important. And of course, protect yourself while you are having sex and having intercourse. This is YouTube. I have to, be a little bit PG. So that after that day, the next day after that, I was among the first group of people to write their pediatrics clinical exam. And our pediatrics clinical exam is long case, where you are assigned to a patient and you collect the patient, take the history, do examinations, write down the investigations. I'm so sorry. Okay, write down the investigations that you want to do for these patients. Talk about your possible diagnosis, investigations that you do, like I said, and how you manage the patient, basically drugs that you give, the patient requires surgery, whatever, follow up, prognosis for this diagnosis that you gave. So I was taken to the pediatric surgery ward. Luckily for me, I cleared a boy that had acute appendicitis. So they had already done the surgery. The boy was very much okay when I went there, so that was my luck. My class were kind of much. So as long as there was a child in the hospital, that child was one of the people used for the exam. That was my luck. The mother was very, very gracious. The exam I met was okay, good, one of the really, really nice ones. So yeah, I did it, and our exam came out a week later, and our results came out a week later, and thankfully I passed. Guys, I passed. So guys, that is everything that has happened to my life. Just new year, but same cozy. But I'm still your girl. Okay. So yes, I believe all of you watched to the end of this video. Okay, don't try me. You watched the end of this video, right? So make sure to subscribe, like, share. Anyway, guys, thank you so much for watching. See you and bye from the latest final year medical students.